The first is that a principle is that anything that requires to be done from a medical point of view should be done virtually as far as possible. The idea being that nobody should really go out. It will help individuals. So not because of COVID, but that is the model of CallHealth. The second is anything that requires a physical touch by a doctor or a nurse or whoever should be done at home as far as possible and not elsewhere. Third principle is if both these principles fail, which is virtual or online, contact and at-home contact, only then should somebody be required to go to a hospital or a wellness center or so on. So that is the principle on which CallHealth was built, which meant whether it is a doctor or a dietitian or whoever, we feel that there should be people should talk to the provider from the convenience of their home or get a wound dressing or an IV or let us say a fitness trainer or a yoga trainer at home rather than go out to a center as far as possible, wherever it is affordable and convenient. Now that is about call health. Now let's talk about what exactly we are discussing in the context of what Bharath just mentioned. You see, I think the first time we had an excuse last year because we got caught unaware. We saw it in China. We were standing there and watching like from the sidelines. And before we realized the COVID was all over us. And I think because of the suddenness of it and because of the fact that none of us are used to terms like lockdown, we took it far more seriously in the first wave. But by the time the first wave subsided, we went on to believe that the Indian or the Asian genes is superior, that we live in such poverty and such contrasting hygiene conditions that no COVID will affect us. So we got into this false sense of security and went out like there is no tomorrow. And before we knew, the wave 2 was on us. And I think we were justified, whether it was Diwali, Dasera, New Year, marriages. We did all of that and nothing really happened to us for 4 months. But suddenly it came upon us again. And I think it was too sudden an issue. Now, here is the point. The message is as follows, that what we have learned in wave 1 and wave 2 is how much ever you think you are prepared, you are actually never prepared enough for what is coming. That's the truth. So you don't have a choice and we don't have a choice but take care of ourselves on a continuous basis as if every person next to us is, as if any other person next to us is potentially a COVID carrier. We have to operate with that mindset. We have to operate with that sense of fear and anxiety on an everyday, every hour basis. That's the first message. Vaccinations are a must. I think people still, let me tell you this. We are doing corporate vaccinations across Telangana and AP. And what I notice is 20% turnout against what is expected in a given location, which means a lot of them are still hesitant if they need a vaccine or not. So my request is, please don't play around on that, because those who are vaccinated, even if infected, are coming off much faster than others who are not. The third dimension I would say is that please look at having an insurance. I have been surprised by the number of corporate colleagues that have reached out to me because the financial situation has got worsened. Because when you go into a hospital and if you are, God forbid, required to be in an ICU, your average per day cost can anywhere range between 50,000 to 100,000 easily per day. Now that means you are going to be suddenly hit by a financial burden that is, it's not that it is not affordable for many, but at that stage in life, you don't have enough cash in your hand or there are not enough facilities. I have seen situations where the husband is in the hospital and the wife doesn't know the details of the financial setting, and there is a lot of anxiety around. So please take care of an insurance, a minimum insurance. Make sure you're vaccinated, make sure you have basic material, but most importantly, live every hour, every day without becoming paranoid, of course, as if every person you meet is a potential COVID carrier. We tend to take things light, whether it is the person at home, whether it is visitors at office, whatever, and even going out shopping and so on. So that's the only thing I would request.
How the home healthcare service providers And what is the role of the healthcare service providers in managing the patients in this COVID pandemic? And how do you plan to address this in third wave? And is insurance covering home healthcare services?
Sure, Bharat. I think that's a very, very relevant question. To begin with, I think all of us here know that there is obviously this inherent fear about COVID. But remember that at least we in CallHealth uh, categorize it into three broad buckets. The first are the set of people who are confirmed positive but are showing no symptoms whatsoever, right? They do it because they came in contact with somebody, went and got a test done, and they turn out to be positive, but are asymptomatic and show no signs whatsoever. A second bunch of people are those who show symptoms, but not very severe symptoms that seem to kind of threaten them. But I mean, some people panic faster, but people who go through symptoms of cough, of let us say stomach upset, fever, and so on, but seem to respond to medication and treatment and do not have breathlessness or serious levels of breathlessness and so on. The third one, of course, are those who seem to have had a high viral load or a low immunity or whatever the case may be, where it is very obvious that they need a distinct care in a hospital and a continuous care in a hospital, right? So these are the three buckets of people. For the first and the second one, we have very clearly seen, and I say this with confidence because we have handled more than 50 to 60,000 people in what we call as remote monitoring of home isolation patients. We have had daily calls going to them from a nurse, periodically from a doctor, checking out how they feel. Some of them have pulse oximeters and thermometers, some of them don't have. So they talk based on how they feel, and we record that. And based on the doctor conversations, we decide whether their medication should be altered or continued, whatever is needed. Some of them may just live on Dolos and some of those basic antibiotics, some of them go on to higher levels of treatment as needed. But we have found that the first two buckets can often be treated with very minimal medical touch and support. You don't need hospitalization, you don't need to rush, you don't need to panic. Just see if whatever symptoms you have are continuous or not. So that's the first point I would say. And I say this with confidence. Having done this, we have seen hospitalization for less than 5% of the people. And we have seen like some fraction of people on to a level where they need ICU. So it can be identified early, sign up for some kind of a remote monitoring care, and it will work out very well without any problem. The second part is, at least Star Health for sure, I know, and I know there are other insurance companies who have now started approving the charges that you incur towards home monitoring or remote monitoring of your home isolation cases. And remember that your cost of a remote monitoring may vary between 5 to 15,000 rupees for a 14-day session. Whereas in a hospital in a single day, you may potentially say, end up spending 30 to 50,000 rupees at a bare minimum. Now, the point I'm trying to make is continue to take care of yourself. Do not panic. Sign up for some kind of a program with a doctor or an organization that offers the support. Take a call only when the doctor is really saying, hey, now I think you need some kind of a hospital administration. The last point is, and I say this out of personal experience from wave 2, I used up a lot of my Kims, Yashoda, Apollo, etc. for all my friends and sources because they were all going through this crisis of hospitalization. I want a bed somewhere. And I realized that when the infection came circle of family, I was calling the same guys and they were not picking up the phone because I had used up the equity that I have with them for getting a hospital admission. And I realized that when it came to some people very close to me, I was not able to get a hospital admission very easily in spite of having so many network hospitals and so many influencers. So the way I would say is keep your equity for that extremely compelling situation. Don't use it up in the first shot. And I can guarantee, and I say this, and I'm sure all the other doctors on this call will confirm that the percentage of cases that require hospitalization are very low. The percentage of cases that get into a high,